Good afternoon, everyone. I'm Dr. A. Santosh Kumar. I'm a consultant nephrologist and a transplant physician in Kamineni Hospital, LB Nagar. So I have been working here as a transplant physician for past 8 years now, and I have a nephrology experience of almost 11 years. Today, we'll talk about the common myths in nephrology. Myths in nephrology, which are usually carried either by not just the pre-existing notions, it can also be because of some other reasons. Either anecdotal reports can be present, somebody would have suggested something, or they would have read something in some of the journals or some sort of YouTube videos, and that would have created some sort of myths which will usually persist until unless you have cleared it up. So today we talk about at least few of the myths. What we have done is we have actually generally we took some sort of a kind of poll we have done in our own hospital to identify our OP patients and IP patients who are coming to us, and then asking them what type of notions do they have about kidney disease, either kidney functioning based, what do they have, what is kidney disease, is there a possibility that they might get it, or how are the symptoms which are present, and what sort of renal diseases can manifest, and is there any treatment for renal diseases or not. Some of the common myths which we found out was that first thing was commonly patients used to say that kidney disease is a very rare condition, and they'll also say if you have, you will know if you have a kidney disease. So this is one thing which you need to be aware about. One thing is kidney disease is relatively rare, but as India has become, as it has already become a capital of diabetes as well as hypertension, we are at a cusp wherein we are going to develop, we're going to see more and more patients who develop complications secondary to diabetes and hypertension because it is uncontrolled, either because of our lifestyle which has changed from previously a kind of developing country to almost a developed country, and we have more of population for there in urban population. So we are becoming more and more predominant or prevalent in diabetes in India. So with diabetes itself, what happens is if let's say the diabetes itself is not in control, we expect that that sort of complications can also start happening. It will start causing some amount of damage to the other organs as well. The organs which can get affected commonly are, one thing is retina, other is kidney, others are nerves. So these things do happen very commonly. Apart from that, because we are in a tropical area, that is because our temperature which are present is almost extreme. Most of the times we have good amount of summer which is there in that summer, and most of the population which is there is all rural population with a agrarian kind of thing. So most of the time they are dependent on agriculture or more of field work individuals who are present. So those individuals are higher. They're going to develop more chances of they'll have more chances of developing dehydration. At the same time, they'll also have chances of developing subsequently renal calculi. Whenever renal calculi develop, obviously you can also have some amount of kidney damage which can happen with renal calculi itself. So though overall in a general population, if you were to see, kidney disease is not so rare, and with the prevalence of diabetes and the type of aggregate environment which is there in our hospital and sorry in our country, at the same time the type of medicines which are used, either it could be a herbal medicine intake or protein over the counter prescriptions which are taken up, so these tend to contribute to new onset of kidney disease. Apart from that, other diseases can be present. It could be a genetic disease which can be present, some kind of polycystic disease or autoimmune related disease can be present. Any other autoimmune disease can also contribute. If some patients have some sort of either bladder or kidney related cancers also, or uterus like cancers, they can also contribute to some amount of kidney damage. So the other myth which we heard was testing for kidney disease is a long and a costly process. So if you are at risk for kidney disease, there is nothing you can do about it. So the third myth is kidney disease testing is not such a long process, and it's not a very costly process also. The commonest screening which we use are complete urine examination and checking for EGFR. EGFR is nothing but glomerular filtration rate, which is calculated by the serum creatinine of a person. So these are two very common tests which can be used on a large scale. Even if somebody has a doubt whether they have kidney disease or not, based on these two tests, we can identify whether they are at risk of developing a kidney disease or not. And can you, they have mentioned the other myth was that if you are at risk for kidney disease, there is nothing you can do. Kidney disease is not like an absolute thing. It's not like binary, that is 0 and 1. It's not that if you have it, you don't have it. It's not like that. So there are stages of CKDs. In sense, it can happen at a very early stage, or those individuals who have let's say GFR, which is on the higher side, more than 90 or so, if only one kidney is there, or they were born with some sort of deformed kidneys, or they have some sort of urinary protein. Those are all based on stages, we keep on dividing it. So as the stage keeps on progressing, the kidney functioning also starts dropping down. And subsequently, in the last stage, they start presenting with renal dysfunction leading to ESRD, that is end-stage renal disease, which can, the only treatment options during that period are to go ahead for either hemodialysis or renal transplantation. So can we do anything about it? Obviously, we can't do about it. The reason is stages do not progress over a day or over a month or so. So it happens over a gradual period of years together. So you have decades of time wherein if you maintain the disease properly, the primary disease, if it is there, let's say a patient is having diabetes, or let's say you have diabetes or a hypertension or any other risk factors which actually contribute to increase in renal failure, those things, if you can curtail it, if you can bring it under control, then the chances that the kidney disease is going to progress is very less. And it happens over a period of time. At every stage, we need to keep on checking how the kidney disease is progressing. And based on that sort of progress, we need to again check and then see the symptoms which are new symptoms which are developing, or prepare you in the later stages for initiating you on either hemodialysis or to go ahead for a transplant if dialysis itself it's not required, or if you have adequate donors in the family itself. So the last diseases, the another myth which was noticed was it's mentioned as no one knows what causes kidney disease. Right. Kidney disease is definitely evolving. Kidney science or nephrology is evolving science. It has been evolving because kidney itself is a very complex organ. It's not that it's a simple organ. It's microscopically. What I keep on telling is it's a beautiful piece of nanotechnology which is there in your body. So to put in perspective, each kidney, which is hardly 10 centimeters or so, will have somewhere near 10 million nephrons. So that's a huge number. Sorry, 1 million nephrons will be present. So it's almost equal to 10 lakh nephrons. So the nephrons are nothing but those are all filters which are there. So each kidney at that level, it has almost 10 million. So 10 lakh nephrons. So what happens is over a period of time, as it just keeps on reducing, till that time, most of the time symptoms are not usually present. And by the time somebody comes to know about it, it's usually in the later stages you can start diagnosis. Why do you get kidney disease? Obviously, there are routine causes. People who develop chronic kidney disease who are dependent on dialysis. Most of the common causes which are there are undiagnosed or at least uncontrolled hypertension is one of the cause, and uncontrolled diabetes, which is these two become the predominant causes. Apart from that, sometimes it's because of the painkiller intake can be present. Excuse me. Sometimes it can be because of some sort of urinary tract infections which are happening repeatedly, or it could be because of other genetic causes which are very rare. So the other myth which we noticed was the only treatment for kidney disease is dialysis. No, it's not dialysis alone. That happens. The dialysis is one of the modality which is used as a treatment of kidney failure. That too in extremes of scenarios. In the sense, if the patient starts developing chronic renal failure, function has dropped down to less than 10% or so, or if the patient starts developing a lot of edema, the complications of reduction in kidney functioning, if they are extreme, in those events, we need to go ahead for dialysis. And it's not the only treatment. Conservative treatment is also available in an early stage itself. If we are to go ahead for good conservative treatment, then the progress to chronic kidney disease can also be stopped. Once we can stop it, obviously, at least we can reduce it. If not stopping, we can maintain it for a longer duration. It might not become, if let's say you have a creatinine of 2, if you are maintained properly, if you are taking your medicines properly with good treatment, your creatinine might come down or it might stabilize to one particular level itself, and we can slow the progress of kidney disease. Might not be able to reverse it. Some events it can be reversed. If let's say there are some sort of events where some sort of diseases where you have called as glomerulonephritis, in those events it can be reversible as well. Right. So again, there was one myth saying that all types of kidney disease are incurable, and yeah, incurable. So depending on type of kidney disease, let's say kidney disease, if a person is having some sort of allergy, in the sense if he is taking some medicine which is actually contributing to kidney failure, those medicines, if you are able to stop it off, kidney will obviously recover. Apart from that, if kidney stones are developing, stones are the one which have actually caused renal damage to have happened, and if it is in a very early stage, we take adequate precautions that further formation of stone is not there, and if there is some blockage of the stone, wherever the stone is blocked, and if it is not, if you are able to get it removed either medically or through surgical intervention, when it is required, in those events the kidney will also improve more dramatically. It's not that all the diseases are of the kidney disease are incurable. Some of the diseases, what happens is you can have glomerulonephritis, as I said, autoimmune diseases are present, wherein the kidney disease can be kept under control for years together. That itself gives a good life expectancy to the patient, and they'll also have good amount of, at least they'll have good lifestyle which can be maintained over a long time. Right. The other myth was, I am all right, so I don't think I have a kidney problem. And second, the similar myth was, I pass a lot of urine, so my kidneys are fine. Good. So If let's say we do not have any other family history is not there, we do not have any comorbidities, in those events probably we might be right in thinking that we might not have kidney problem. But as a policy, what I tell my routine patients who are either non-diabetic and hypertensive, which they come, if they come with some other issues also, is if you have some family histories there, or previous episodes of you have renal calculi, renal stones are there, you had recurrent UTIs, or family history of diabetes is there, or hypertension is there, or you had some history wherein some infections were there which have contributed to renal failure. In the absence of everything, if you are slightly at a higher risk because of your lifestyle changes, or probably because of your family history itself, in those events, or more than 40 years of age, for all those individuals, I always advise them to go ahead for annual health checkup or annual health screening. Apart from that, the routine precautions, what I tell them is to go ahead for a good life, means normal lifestyle should be managed. See that you do not take some lot of junk food, have a healthy diet, take adequate amount of water. See that you don't take unnecessary medications which are required. Even if you require painkillers, take it in a prescribed format. In sense, if you take it, if it has been prescribed for 5 days or 10 days, use it only for that duration itself, but not more than that. So in those events, what happens is, if we are able to recognize it, till that probably we can at least start identifying it. The point comes is when they say that I am able to pass a lot of urine, or because I'm all right, I might not have a kidney problem. Kidney has a beautiful capacity, or it has something called as, it has excessive capacity. So if you are, if our blood is somewhere near, let's say 5 liters for a person who is somewhere near 75 kgs, 5'6" to 5'9" height, kidney filters per day almost 120 liters per day. So the capacity to which it increases, or which it keeps on filtering, is at a very high quantity. So if it drops down to somewhere near 60 liters, you will not develop any symptoms. If it drops down to somewhere near 40 liters, still you will not have any symptoms. As the filtering capacity just keeps on dropping down, then you start developing the symptoms. The symptoms can vary from a lot of things. That is, if the primary disease is diabetes or hypertension, one of the things which probably patients might be noticing is they start developing lower sugars. That is, the patient had insulin requirement, or he has been using some oral tablets he has been using. Suddenly they notice that his BP, his sugar has started falling down. So in spite of using the same dose, same amount of food intake and everything, they start noticing that sugar has started falling down. So in those events, we can recognize probably that kidney failure has also started up. So in the absence of it, it's very difficult to identify whether kidney disease is there or not. So as a general protocol, what I would suggest is screen yourself or with a complete urine examination, and to go ahead for a simple test like serum creatinine, which can also tell us the EGFR, or glomerular filtration rate, to identify at what stage of CKD we are present, or at what risk are we present. Right. So coming to that myth that I pass a lot of urine, so my kidneys are fine. What you have to understand is urine output usually does not drop down in most of the CKD patients. Chronic kidney disease or any sort of kidney failure which is there, usually there is no decrease in urine output at all, or there won't be any fall in output. If output is good enough, they start, if means if the patient has to develop sudden urine output which has come down dramatically, then most of the times it can be because of stones which have blocked both the kidneys, or probably by birth he has one kidney and which has he has suddenly reduced, means urine output has suddenly dropped. In the absence of it, urine output can drop with other etiologies, like say if the patient is dehydrated, he had recurrent vomiting, nausea, or he had a lot of acute gastroenteritis, loose motions, etc. has happened. That reduced the body's amount of water which is supposed to be present normally. That can cause the kidneys to start reducing the kidney function. In the absence of an acute problem, chronic kidney disease usually will not have any other reduction in the urine output, will not be there. If glomerulonephritis, that is some sort of autoimmune diseases are present, they usually start losing urine output over a period of weeks to months. Gradually it develops. In chronic kidney diseases, usually if the loss in urine output is almost not seen, until unless they have a lot of protein loss in the urine, they usually start developing decreased urine output. In the absence of it, most of the times patients do not have any change in urine output. I have a lot of CKD patients who are on dialysis who maintain that urine output for a longer day. In spite of being on dialysis for years together, their urine output is also maintained like that. Right. So one more myth was So one more myth was the dialysis once started is required lifelong, right? So dialysis is a modality, or it's a type of treatment which is used when kidneys are not functioning. Kidneys might not function because of some acute event. Acute event in the sense, let's say a patient develops urine infection, as I suggested just before, urine infection can be present, or acute gastroenteritis, loose motions would have developed, or some person has taken some sort of antibiotics or some other painkillers, or patient has developed some allergic reaction to it, or a patient might have by both sides stones which would have caused kidney to get the pipes, the ureters which are there, they should mention. In these scenarios, dialysis doing is life-saving procedure. The reason is kidneys are normally functioning. They are not able to function because of one particular event. That event, if we are able to treat it, or if we are able to control it properly, then the kidneys will also improve dramatically. So dialysis can be used in chronic renal failure if the kidneys have dropped down to such an extent that they are not able to support the body properly. To give an example, as I said, GFR, once the GFR drops on somewhere near 10% or so, in those events, we can go ahead. Or patient dialysis is also used for non-renal indications also, non-kidney patients also, we can still go ahead. The reason being, dialysis is nothing but you are literally purifying the blood through a filter, or you're running the blood along a filter and then seeing whether it is getting purified or not. So in those events, if let's say a patient who has had some sort of poisoning, in those events also we can go ahead. Or patient has developed some sort of urinary tract infection or some other infection which is contributing to kidneys to fail immediately. In those events also we can go ahead. So there are multiple creatinine is quite high, 7, 8. Obviously, the risk of damage to the brain or scenarios, chronic scenarios, non-renal, non-kidney diseases also, it can be used. Some sort of indications, what happens is you use a dialysis machine for doing other things also. In autoimmune diseases, to remove some antibodies also, we can go ahead for dialysis. It's a procedure, etc. is same, but the filter which we use is completely, that's called as plasmapheresis. That's completely different. Right. So the other myth was, I think, which this we have cleared. That is, you cannot prevent a kidney disease. Myth is that you cannot prevent a kidney disease. Kidney diseases, most of the times, the reasons, as I suggested, either diabetes, hypertension. So the risk factors which are already present, those risk factors have to be recognized a bit early. If you're able to recognize them a bit early, we can start controlling the disease per se, and that disease is the one which is actually going to contribute to kidney failure. So that way, we can actually reduce or prevent the kidney disease itself. So the other myth which we noticed was kidney stones are the reason behind kidney disease. So as I said, there are multiple causes for developing kidney disease. So kidney stones are one of the causes. Probably in tropical India, tropical country like India, it is one of the predominant causes, but not to that extent. In urban scenarios, etc., what we see is we commonly see more of diabetic and hypertension related. In rural environments, most of the times rural areas, we start seeing renal failure secondary to some sort of infections like acute gastroenteritis, or renal calculi can be present, or herbal medicine induced renal diseases and painkiller induced diseases. Those kind of things we keep on seeing based on the area where patients stay. Right. So one more thing was, frequent urination is a good sign of a healthy kidney. Right? Urination, your body requires certain amount of water to maintain itself, not just for the normal functioning of the body. At the same time, it is also required for normal functioning of your gut. It is also required that it maintains, kidney is a kind of organ which maintains homeostasis. That is, it keeps on checking how your blood is present, whether your blood starts developing some sort of impurities or not, or does it have some amount of excess water which is there, or are you dehydrated? Should you save your water? Everything is done by these kind of things are done by the kidney. So frequent urination can happen in the presence of a renal failure. In sense, chronic kidney disease, most of the times the kidney loses its ability to reduce the urine production which is there. In sense, let's say I don't take any water throughout the day today, my urine output will drop down to save the amount of water which I'm losing from my body. That way, kidney assesses. In chronic renal failure, that sort of assessment or that sort of recognizing that a person is become dehydrated is not there. So kidney does produce urine which is consistently throughout the day and throughout the night. So the common symptom which we keep on seeing in chronic renal disease patients is they say that I keep on getting up in the night 2 to 3 times per day to pass urine. And when I'm passing, I'm able to pass it normally, but I keep on getting good amount of urine. So in those events, always remember that whenever there's a frequent urination, the predominant thing from kidney point of view is to rule out whether it is a chronic kidney disease or not. Second, more common diseases which are present are diabetes is a very common disease. If diabetes is one thing which is not under control, sugars are very high, more than 200, if it is consistently present, more than 200, the moment it is there, your kidney has the ability to absorb sugar only up to 200 ml. Once it crosses more than 200 ml, it does not absorb it and it starts losing the sugar in the urine itself. And as the sugar is lost in the urine, it starts pulling out more and more water from the blood itself. So that contributes to dehydration and it increases urine output. That contributes to dehydration and increase in thirst also. So diabetes is one of the commonest things which we need to rule out whether one says that we have frequent urination. Other things are could be there are some events wherein you have bladder abnormalities, so bladder will not be able to function properly, so it does not retain urine for a longer duration. It retains it very shorter duration, or small amount of volume alone it can retain. In those events also, frequent urination is one of the symptoms. The other diseases, right? So the other thing which is commonly said is right. So they mentioned that kidney disease is accompanied by lower back pain or kind of side pain, which is always present. Right. So kidney disease, can it cause back pain? It does cause back pain when there is kidney stretching, which can happen. Kidney stretching can happen when you have an infection within the kidney, or if there is a stone which has passed from the kidney to the ureter. In those two events alone, you will start developing pain. In the absence of it, most of the times you will not have any symptoms of back pain at all. To put in perspective, your kidneys are quite inside. That is, if you have to see from your back, you have skin, you have muscle, you have even the bones are there, then you have some nerves. After that, your kidneys are present. So all these things which are present, they can definitely contribute to back pain or side pain. And as most of the times when the patient presents with this sort of symptoms, which is colicky, that is, we have severe pain, which is radiating from backside to front, and then it is going towards the lower back. So the pain just keeps on shifting down and down. As it keeps on shifting down, people may complain saying that they have pain at the scrotum level or penis level. Penis also, they can have pain. It is a typical symptom of urinary calculi or urine stone, kidney stones if they're present. Once it starts passing from the kidney to the bladder, the pain also keeps on changing. From the top, it just keeps on coming down. So that's a typical symptom of renal stones. The other thing is if the patient has pyelonephritis or infection which is there in the kidney itself, then also patient might complain of a pain. Or if the patient starts developing some unusual events, if they're not taking treatment completely, or a diabetic individual is there who has developed some sort of complication of diabetes. In those events, kidney will get stretched. That can also contribute to pain. In the absence of it, most of the times, pain in the lower back is not suggestive of a kidney disease. It might be because of some orthopedic reason. And in extremes, in simple things which can be ruled out, even vitamin D deficiency can be present. That can also contribute to back pain in chronic kidney disease or kidney failure patients. Right. The other thing was patients mentioned that kidney disease is always caused by aging, right? So by 40 years of age, most of your kidneys have improved to such an extent that they're almost maximum level of functioning is there. In sense, from up to 40 years, the increase in GFR just keeps on increasing. From 40 years, there is a decline in the kidney function. To what extent does the kidney decline? It decreases by almost 1% per year, or roughly 10% per decade. So that's a normal age-related reduction in the kidney capacity. That doesn't mean that every person will have the same sort of kidney decline which is there, because we have seen a lot of individuals who had good kidney functioning till the late, that is almost 80, 70 years of 75 years of age also, they had very good functioning. That GFR which I was talking about, it can still go up to somewhere near 90% in those individuals. So it all depends on probably your genetics and your if you have some disease, did you keep it under control, or if you have some problems which you have taken treatment properly or not. All those things also matter a lot. So the other thing which they have mentioned is only patients with people with family history are at risk. Genetics does contribute to a good amount of renal failure cases, but most of those individuals, what happens is you have either cystic diseases can be present, or sometimes in the absence of cystic diseases, some diseases can contribute to increase in developing either infections or increase in developing autoimmune diseases, or some sort of events wherein there is some deficiency called as complement related diseases. These things can be contributed because of genetics alone. So apart from that, if family history of diabetes and hypertension is there, that itself is a very high risk factor of developing a chronic kidney disease. Right. Other thing was to prevent kidney disease, there were some myths. One thing was saying that drinking adequate water can prevent, or eating a low protein diet can prevent kidney disease, or taking supplements can prevent disease, or herbal supplements can also prevent kidney disease. So coming to water intake, what I would suggest is, I think the age-old dictum of saying that 8 glasses per day is enough, but those 8 glasses can make a big difference for a person who is probably normal weight and height in an environment which is well controlled. He's not going outside in summer or a lot. He doesn't move about a lot. In those events, probably 8 glasses per day should be more than enough. If let's say if a person who is working, so as I said, ours is more of a tropical country, so we have good peak summers are present. In those events, there is always a possibility patients do get dehydrated. They keep on working in fields, so in those events, there is always a possibility they'll become more and more dehydrated because of the sweating. That can contribute to dehydration, which is chronic. It's not acute dehydration, but it is chronic. So that can definitely contribute to developing renal stones. So kidney disease per se, just because you're taking good amount of water, does not come down. If you're taking adequate water, only stone-related issues which are there, stone-related, kidney-related failures which can develop, those things can alone be prevented. Apart from that, nothing else. Again, water intake varies from person to person. Probably for a person who is slightly short weight and less height and weight, they might require a bit less. And slightly body weight is on the higher side, they might require more. If you are working more in a kind of controlled environment wherein you have a good AC, good fan, temperature is also well controlled, you might not require that much amount of water intake which is required. Let's say you work in an environment wherein you have a lot of there is a tendency to become dehydrated is very high. In those events, you require more and more amount of water intake which has to be present. And in certain genetic diseases, what happens is you need to require good amount of water. That is, cystine stones are forming. In those diseases, what happens is you require a lot of water intake to prevent development of renal stones. Coming to supplements and herbal supplements, I don't usually advise supplements to be taken for any person. If you are able to maintain your normal healthy lifestyle and you're taking a good healthy diet, in sense combined complete diet, if you're taking it, you should have good amount of carbohydrate, good amount of roughage which should be present, fiber should be present, adequate amount of fruit should be present in your food. And if it is a balanced diet which you're taking, even protein diet, if you're taking all, if it is balanced, then we need not be worried about taking further supplements. Some patients do suggest to go ahead for herbal supplements. So herbal supplements, one thing is there are some concerns about herbal medicines or herbal supplements which can contribute to renal diseases itself. So previously, I think there is one herb called as Chinese herb related nephropathy. Those type of herbs which are routinely present, if they are mixed up or if that quality control is not there, probably they can definitely contribute to kidney failure itself. Apart from that, can we reduce by taking supplements? Supplements, most of the time, supplements we do not advise until unless if the patient is becoming, if a patient is chronically ill, his diet is not so adequate, let's say he is not having much of muscle mass, or if let's say a patient is on dialysis, he keeps on losing muscle mass, he's becoming more and more smaller and smaller. In those events alone, we advise to go for supplements. Otherwise, we do not usually advise. Or if diet is one thing, if they have, if a patient is a diabetic, probably vitamin B12 supplements we can advise. Otherwise, these supplements, they do not do anything to prevent kidney disease from developing. Right. So one more thing was, yeah, I think I didn't address this. Eating a low protein diet. See, low protein diet is a very different concept. Most of us require at least 1 gram per kg per day of protein per day. So whatever protein you are taking from your vegetarian vegetables or vegetarian, let's say either wheat based or rice based, you have at least 10% of protein in the rice and wheat. So apart from that, vegetables will be having separately. So you should have certain adequate amount of protein in your diet. If you have adequate amount of protein in your diet, that actually does contribute to maintaining your healthy lifestyle. At the same time, body mass is also maintained properly, muscle strength is also maintained properly. So this will help you out. Low protein diet is usually advised in those individuals with kidney disease who have a lot of protein loss in the urine. The concept being, if you keep on increasing, if you keep on taking more and more protein diet, the loss of protein which is happening in the urine also keeps on increasing. As the protein loss in the urine increases, the fall in GFR or the kidney functioning also drops dramatically. To give us a simple example, it's like saying, if let's say a patient has almost 4 grams of protein loss, the kidney functioning drops down by somewhere near 4% per year. 10 grams, it drops down by almost 10% per year. So the kidney failure also progresses more rapidly as the amount of protein loss which is happening. And that protein loss is increased by your dietary protein intake. Right. So I think there was one more myth saying that healthy individuals do not need to worry. This I'm not inducing a kind of panic or something, but see, to say that a person is healthy, it's not just we should look healthily outside itself, but at the same time, your organs which are there, they should also be normally functioning. And keeping a kind of you are surveilling or having a monitoring your health is also very important. So for that reason, as I suggested, yearly once, probably going ahead for a health checkup will identify whether we have some sort of any sort of disease. It could be a thyroid or hypertension or diabetes or any other sort of disease which are present. They can be picked up at a very early stage. Right. One mentioned myth was that kidney failure can occur if one kidney fails. So that is one of the prominent myths. So whenever I start dialysis for any of my patients, they ask me, is left kidney failed or the right kidney has failed. So what you have to understand is both kidneys function almost parallelly. They parallelly keep on clearing the blood. Let's say it's like telling a person, don't use your right hand. What do? You obviously use your left hand. The same thing happens in these things also. If let's say one kidney is not functioning, other kidney does take over the function. If the kidney is suddenly blocked, so if a patient has some urinary stone which is present only in one kidney, then creatinine does not rise until unless the other kidney is normal. If it is abnormal, it's not functioning properly, then in those events creatinine can still rise. If creatinine is rising, that shows or that means that both the kidneys are not functioning adequately. And dialysis, if it is rare, it means that both the kidneys have failed, and that is the reason we are initiating a person on dialysis. Right. The last, I think I have still some 5 or 6 myths which I'll just complete it off in another 10 or 15 minutes. The one myth is they have mentioned that in kidney disease, the presence of edema suggests kidney failure. So edema is nothing but swelling of feet. Swelling of feet can happen because of multiple reasons. One thing is any of the organ abnormalities. That is, if the heart is not functioning properly, or if the patient has some sort of kidney disease, or liver failure is there. In those events, it can definitely lead to contribute to swelling of the feet. Apart from that, the other things which can happen are if the patient has low protein in his body, or the protein losses are happening in the urine because of the kidney failure, that can also contribute to increase in swelling of the feet. Apart from that, if the patient's hemoglobin is not adequate, his hemoglobin is very low, he's deficient in iron, overall he's chronically malnourished. In those events also protein loss will be, protein production will not be there, HB will also be low. These things do contribute to edema. So just because edema is there doesn't mean that kidney failure is present. Kidney failure in the presence of swelling, it can be because of any other organ abnormalities also. And second, the caveat here is then some patients who have kidney failure will not have any edema at all. So that's a general classification which is usually done in chronic kidney disease. It's called as chronic glomerulonephritis or chronic interstitial. So chronic glomerulonephritis, what happens is you have a lot of swelling which is there. Urine production will also drop down, and a lot of edema is there, and they tend to develop renal failure more rapidly. If chronic interstitial nephritis is there, then you don't develop much of edema. They might have some amount of shortness of breath, or electrolyte imbalances can be present, or they can also have some sort of anemia which is more prominent in them. Right. So the other concept is all patients with kidney disease should drink large amount of water, right? So I suggested if you were to take into consideration only the water intake and kidney, probably it's going to prevent only the formation of kidney stones alone. In the absence of it, most of the times kidney failure, increased water intake is not going to make any difference at all. Second, this is usually present for those individuals who do not have underlying edema, or let's say a patient who has liver dysfunction, or liver which is not functioning properly, and heart which is not functioning properly. In those events, if you were to go ahead for excessive water intake just because your kidneys are failed, the progress of the disease is going to be more rapid in those scenarios, because in those scenarios, as the water keeps on increasing, that contributes to the organ failing a bit earlier. It does contribute to heart failing a bit faster. In kidney failure patients who have a lot of edema, if excess water intake is there, it contributes to increase in water in the body, increase in the water which starts in the lungs. There are higher chances that they'll have recurrent admissions for excess water removal. Apart from that, because the swellings are there in the feet alone, a small scratch can start an infection which can become life-threatening. So water intake has to be taken in For instance, whatever, to put a simple perspective, I always advise my patients to say that, to remember that your thirst is a guide for taking how much water you want to take. That is, if CKD is not there. If they have a lot of swelling, we have to restrict till the swellings have completely dropped down. Then probably based on urine output, how much urine output is there, plus 500 ml or so, you can go ahead. In a peak summers, we usually advise slightly more leeway. At least we can go ahead for some, at least another half liter or 1 liter extra also we can take it to prevent whatever losses are happening during summers because of the sweats, because of the sweating, or because of the dry environment which is there with your, through your respiration also you're losing a lot of water. To overcome that losses, you tend to increase the water intake to the patients. Right. So this is a common question. People say that, patients say that my serum creatinine level is slightly above normal, but I'm perfectly well. So is there anything to be worried about, or there is nothing to be worried about? So as I suggested, creatinine is a kind of, it's a good marker. At least it's not an ideal marker. In the sense, let's say, as I suggested that I had told previously that kidney has a ability to function almost up to 120 liters per day, or it filters up to 120 liters. Till it drops down to somewhere near 30 liters or 40 liters, creatinine will not change at all. So till that level, creatinine does not increase at all. A slight raise in creatinine should definitely contribute to think that patient whether there is there a chronic kidney disease which is underlying and which is probably kind of well managed for that particular person and that particular body size and everything, that we have to remember always. So just because creatinine is slightly elevated, you have to remember that there is always a possibility it can definitely be a chronic renal failure. Apart from that, can there be raise in creatinine in the absence of chronic kidney disease? So if a patient does not have chronic kidney disease or kidney failure, can creatinine raise? Yes, it can raise. There are some events where it can raise. So what happens is creatinine always depends on your muscle mass. So a person who is, let's say, lean body weight is not that much, their creatinine will usually in the lower side. To give an example, if you have to compare males versus females, males usually tend to have slightly higher body mass, or at least they have slightly higher muscle mass. That contributes to slightly raised in serum creatinine. Females tend to have slightly lower creatinine, almost 0.8 or so. If it's a person is very hefty weight, that is someone you have 90 kgs and is purely muscle or so, in those events, the creatinine might increase to 1.2 to 1.4. Not so person to person. This is again completely normal. It also varies based on your diet as well. So if let's say diet of the person is relatively, it's like they are relatively higher protein intake is there. So non-veg intake or animal-based protein intake, if it is there, then that also contributes to slightly higher than baseline serum creatinine, which can be present. Apart from that, sometimes even vague diseases can be present, like if let's say muscle injury has happened because of either medicines or because of trauma. In those events also slight raise in creatinine can happen. And the most important thing is we keep on seeing nowadays patients who come and say that I started going ahead for gym to lose my, at least lose my weight, and they started giving me some supplements to improve my muscle mass. So improving the muscle mass, what they do is they give something called as creatine. So creatine is a substance which usually it gets converted to creatine in the body that helps in improving the muscle mass. That at the same time, creatinine, as it keeps on increasing, changes to creatinine, though muscle mass is on the higher side, creatinine, baseline creatinine level also keeps on increasing. So it can increase to somewhere near 1.7 or 8. So there were a few patients whom we had evaluated. We kept on searching for all other diseases. We could not find anything. Finally, the patient came forth and said that I have been going to a gym, and there I have been taking this sort of white powder. So that creatine can also contribute to raise in creatinine value in the absence of a kidney disease itself. Right. So the last thing is, I think related. This is related to the kidney transplant. That is, they have mentioned that one of the myths is that kidney transplant will cure chronic kidney disease. Does it do like that? So it's like chronic kidney disease. Once it extends to a period where it has progressed to a condition wherein it's not able to support the body. In those events, chronic renal failure, kidneys are not able to support the body. Then we tend to go ahead for dialysis. So dialysis either can go for hemodialysis or peritoneal dialysis, and if a patient is under follow for a longer duration, we can go ahead for a transplant in the absence of dialysis itself. That's called preemptive transplantation. So these two events, it can do it. And any kidney transplant, if it has been done, you need to be very careful. It doesn't mean that it's not like a blood donation which has been done. So any person who has donated, he is clear. Who has taken the blood, they are completely clear. It's not like that. Kidney transplant is quite complex. The moment a person undergoes a kidney transplantation, you require a lot of medications which are there to maintain the kidney, to bring your immunity to such an extent that it does not recognize the kidney or it does not cause any harm to the kidney. At the same time, there is always a chance that the first 3 months to first 1 year, you are at a very high risk for developing any sort of urine infections or any sort of infections. So to prevent that, you require a lot of medicines. At the same time, a lot of monitoring from your own side is required. You should never stop any of the medicines which are there. Once that 1 year period is done, probably if the maintenance regimen has also come down, it is quite all right, then probably we can use it for a kidney will last for at least 10 years or 15 years it can run. Some of the individuals, it tends to run more than that, provided they are under proper follow-up and proper follow-up of a nephrologist. Last, some patients do come and say that if I donate a kidney, am I at risk? Can I donate a kidney to anyone? Right. So anyone, I might not say, because our at least the rules as per government are very strict. You need to go ahead for only those individuals who are related. So related in sense, either blood related, in sense family members who are present, either grandparents, parents, siblings, children, grandchildren, or let's say brothers and sisters and spouse. So in these groups, we can definitely go ahead for a transplantation with the committee approval within the hospital itself. Any other person, either it could be uncles who are there, either maternal or paternal uncles or aunts, or any other cousins who want to give, they fall under a category of non-related or unrelated. In those events, we need to go ahead for a separate permission from the DME itself. So in those events, we won't be able to, means we cannot go ahead. It's not so simple. We require additional permissions which are there. After taking up all those permissions, we can definitely go ahead for transplantation. The other persons who are present are called as altruistic or emotionally related donors. Emotionally related, it could be your best friend or your neighbor with whom you have been in contact for a longer duration. Can they give? If their motive is to see that you are all right, you need to come out of this disease, have a good long life. If that motivation alone is there and they recognize that kidney disease, they are donating one organ, so they are obviously inducing themselves a bit of harm at the advantage of giving you a good life. They understand and then go ahead, then obviously we can definitely go ahead for transplantation. So as a donor, if you want to go ahead, what we do is we always check, we always see that donor is never at risk. That is, donor is evaluated in detail to identify whether they have any risk for developing renal failure in the future. If let's say we remove one kidney, is there a possibility of that person, the donor, developing some disease or not? Everything is evaluated prior to this itself. Apart from that, surgery itself takes almost 4 to 5 hours. For the donor also, it takes 2 to 3 hours. Other 2 to 3 hours it takes for the recipient. So whether the donor is able to sustain that risk of surgery, that is also important. If all these things are clear, then definitely we can go ahead. I think hopefully I have cleared up all the myths, at least regarding the kidney failure. And one thing is, patients do ask me, I keep on taking a lot of leafy vegetables, and I take a lot of calcium supplements. Can it contribute to renal failure or renal disease or not? Right. That's a good concern. The reason is, if most of our leafy vegetables we keep on taking it, they have something called as oxalates. So oxalates are those things which are, though they are absorbed in the blood from the intestine properly, they do not mix up in the blood. They tend to form crystals the moment they form in the urine. So oxalate stones forming is very common, and with calcium they tend to form something called as calcium oxalate crystals. So you need to reduce your leafy vegetables slightly. It's not that if you have a habit of taking a lot of leafy vegetables per daily, then I would advise better to stop it off. And better to stop it or reduce it. You can start using those leafy vegetables for the kind of flavoring, etc. You can use it for curries or some other things. You can use it, but not completely. If recurrent stone formers are there, then for them I advise better to reduce their leafy vegetables. Second, calcium supplements. Can calcium supplements alone cause renal failure? Calcium, whenever it is taken orally, if you're taking empty stomach, the calcium absorption which is there, it immediately increases in the blood. That can increase the calcium secretion in the urine itself. Once that urine calcium increases, small stone formation can happen. To prevent that, what we do is we always give it after your food intake. That is, if the patient has taken some lunch or breakfast, we advise them to take calcium with the diet. That actually reduces their chances of developing kidney stones. hopefully, I think most of the myths which I've addressed in this small or probably slightly prolonged talk, which is probably I would have covered up everything. If anything is there, you can definitely come and meet me. I'm present in Kamineni Hospital, LB Nagar, and hopefully I can still